Association in Michigan, I want to let you know we are absolutely thrilled that you are here to join us tonight to honor two individuals that are really mental health champions, Dr. Sheryl Kubiak and Sheriff Jerry Clayton. I'd also like to give a note of gratitude to Synovian for their sponsorship of this evening. I hope you had a chance to say hello to Stacy at her table during the reception, and I want to say a big thank you to Stacy and Nancy and all their team for their support in mental health resources. Also, a huge note of gratitude to Capital Strategies Group, tonight's Friends sponsor. So I want to thank everybody. I also want to take time to recognize some folks that are in the audience today. We have joining us Representative Mary Whiteford is here today. And from the Senate Majority Leader's Office, Senator Mike Shirkey, we have Danielle Devine with us today. And from Representative Felicia Brabeck's office, we have Morgan Foreman joining us today. So thank you for being here. Before we go any further, I really want to introduce Arlene Gorelick, who is the board chair of the Mental Health Association in Michigan.
Thank you, Mary Ann. I just want to say on behalf of the board of directors, many of whom, we're statewide, it's sometimes difficult to have something somewhere, one part of the state, to welcome you all and thank you all for coming as for this tribute dinner as we are honoring tonight's honorees. And I want to thank the sponsors again for their help with this. We hope you enjoy this evening. It's sometimes, to me, it's still feeling a little weird being out in public. I don't know about you guys. And not having here we are sitting in a room. It's pretty spread out, but I'm glad we could all make it because I've seen some of you in pictures, some of you on Zoom, and here we are all together. I'd also like to thank the staff, particularly Mary Ann for her hard work, but also Kristen and Matt, who really helped put all this together tonight. So on behalf
introduce Algeria Wilson, Director of Public Policy for the National Association of Social Workers, Michigan Chapter. Put your hands together. Welcome, Algeria.
Thank you, RJ. And thank you again for having me. My name is Algeria Wilson, and I'm the Director of Public Policy for NASW Michigan. It's my honor this evening to introduce my colleague, Dr. Sheryl Kubiak, one of our honorees for the tribute dinner. Dr. Sheryl Kubiak is Dean and Professor in the Wayne State University School of Social Work and Founding Director of the Center of Behavioral Health and Justice. Prior to her current position, Dean Kubiak was a professor in the College of Social Science, Department of Social Work at Michigan State University, and research associate in the Institute for Research on Women and Gender in the Substance Abuse Research Center, both at University of Michigan. Dean Kubiak obtained her graduate degrees from the University of Michigan and a BA in social work with a minor in business administration from Madonna University. Dean Kubiak's interest in the intersections between criminal and legal systems and behavioral health began 30 years ago when she developed and administered a long-term residential reentry program in Detroit for pregnant women addicted to crack cocaine. Since then, Dean Kubiak has received funding from national and state government, as well as foundations to research and evaluate projects such as substance abuse treatment within prisons, mental health courts, and integrated substance abuse and mental health treatment for those involved in the legal system. Professional contributions include involvement as a member in peer review panels for the National Institute of Mental Health and Fulbright Awards. Currently, she's a private investigator on cross-site evaluation of pilot diversion programs statewide and a prison reentry project for those with opioid addictions. Dean Kubiak has served as a gubernatorial appointee to the Michigan Joint Task Force on Jail and Pretrial Incarceration and the state's Criminal Justice Policy Commission. Again, congratulations, Dean Kubiak. NASW is very proud of you, and so is the Mental Health Association of Michigan.
Thank you very much. And this is so special coming from Algeria. We were just on a webinar at 4:30 today, so I appreciate it. And thank you very much to the Mental Health Association. Marianne, where are you? Oh, there you are. Yes, that's really very nice. Thank you so much.
Yeah.
All right, so Marianne has asked me to say a few words, and so I'm going to talk about what this means to me. And I want to first thank my husband, Mike, who's here, who continues to remind me that there are only 24 hours in a day. And I don't listen very well, but I'm accepting this award on behalf of the work of the Center for Behavioral Health and Justice at Wayne State University in our School of Social Work. Because of the work we do collectively, I shine because they shine. And I want to acknowledge them tonight. So thank you for all your contributions and the support. I started this work a long time ago when I had a realization that there, for the grace of God, go I. There were a few times in my life where I made some bad choices, and Sheriff Clayton could have picked me up and taken me to the Washtenaw County Jail. But I realized I started to work with the incarcerated women, and hearing their stories, I could see the similarities. And I could see that these women who had often or misdiagnosed mental health and substance use disorders could have had a lot of different choices had they had the resources, had they had treatment, had they had services. But being incarcerated, and particularly having the separation between their children and after they were born, was quite motivating for me. And it is why I continue to be motivated to do work to divert and deflect individuals from the criminal legal system. Why? Because we know that being incarcerated for someone with serious mental illness is likely to exacerbate their mental health systems. And we also know from some of the work that we've done that people with mental health issues inside the jails often spend double the time that others serving similar sentences or for similar crimes spend. So through the behavior issues, lack of medication, continuity, there's acting out, and also, as jail staff have told me over and over, this is not the training they receive. They are not mental health professionals. So we fast forward here today, and for those of you who aren't familiar with the Center for Behavioral Health and Justice, we are currently working in 27 counties and have 41 staff members who work to facilitate change at a county level. And that change comes through technical assistance, evaluation, and support. And when we know that we work through the sequential intercept model in each county, and those of you who are unfamiliar with that, that's a framework that says at every single phase in the criminal legal system, whether it's law enforcement, courts, jails, probation, parole, there is an intervention that's possible. And so the external facilitation that we provide is not because people are unwilling to do this work, but that the resources are deprived and people are siloed in counties just like they're siloed in the state. And so we act as additional support and resources to come into the county and work with stakeholders from sheriffs to jail administrators, CMH, provider agencies, substance abuse agencies, and we say, let's look at this. Let's look at the system. Where can we prevent people from going in? And that's been very successful. And I think that more and more counties are interested in doing this because they are concerned about not only the fiscal costs, but the human costs and the toll that it takes when people are incarcerated rather than served in the community. So I want to just give you a few takeaways from some of the work that we've done and some of the important aspects that I think are important as we move forward to try to improve our systems and improve collaboration. The first is how important the relationships are across systems. I think that Sheriff Clayton, I'm so proud to be here with you because the County of Washtenaw and the leadership that Sheriff Clayton has shown and demonstrated in the collaboration with the community mental health has just been a wonderful model. And that is not a model that we see in many counties. There is a lot of misunderstanding of roles. There's a lot of acrimony and a lot of judging between often the mental health professionals and those in the criminal legal system who are working on public safety issues. And so we work to create those bridges. We contact people monthly for little huddles about what's working, what's not, how can we help facilitate change. But I think those relationships and some of the funding that was available through the state for the diversion pilots mandated that those systems work together. And that was a beautiful thing to witness and watch, because when that collaboration blossoms, that innovation and change happens. So that's one thing. The second thing is that we're talking, this is the Mental Health Association, but substance use disorder is in the DSM, right? And we cannot forget the importance of how co-occurring disorders affect the trajectory of people who have mental health issues. We know that their outcomes tend to be worse. They tend to recycle back into the systems. And we have to get better about integrating mental health and substance use treatment in the community as well as in the institution. They're co-occurring for a reason, and their treatment and intervention takes the collaboration between those treatments to be successful. I think the third thing that I want to bring to your attention, and that all of us are aware of post-pandemic, is workforce issues. Nowhere, I think, is this more critical right now in this post-pandemic world than when talking about mental health professionals. As I travel around the state and listen to people, I hear programs closing. I hear people not taking in new clients. I hear the tragedy of people waiting months for service when they're having a mental health crisis. We've got to think about workforce development if we want to get back on our feet as a society and we want to prevent the incarceration of individuals. I think we also need new skills developed. I was talking to Representative Whiteford about this earlier, is that the crisis responses networks that are picking up around the state, when we're combining these skills, there's not a lot of people who have that skill, who understand the criminal legal system and the mental health treatment and de-escalation. And so we need some new training of the workforce. And finally, I want to say, I know there's a lot in the ether about changes around community mental health and around treatment in general. I'm the first to tell you that I think we can all do better. But I want to say that our research has found there has been some benefits of working with community mental health. And that includes having a point person at that county level. When I talk to some of the prepaid health plans and the private insurers about, are you going into the jails? Are you doing continuity of care after? And they look at me like they've never really considered that before. And that's really critical. We not only have to do in-reach into the jails, we have to do stronger continuity of care as people are leaving jails, because we do not want them to return to jail. Having a point person in that county who can work along a county level to find out who's doing the training for those law enforcement officers, who's doing the diversion, who's doing the treatment inside, has been critical to the work and the progress that we've made. And I don't want us to forget about how important that collaboration cross systems is in preventing that incarceration. I think the other point that I want to make in terms of the research that we found is that when we've looked at jails across the state and we look at who's more likely to go into treatment, who's more likely to stay in treatment, it's the people who were in jails where they had a connection with community mental health. Those jails that we go into that have private providers who do the mental health care have not shown in the data to be as connected to community resources and to discharge planning. So I want us to remember those things as we think about changes. We need improvement, we need help, but let's think about the changes that we make, particularly at these intersections around criminal and legal. So I appreciate many of you. I have enjoyed seeing some very old friends, and I look forward to making new friends and creating stronger alliances across systems. So thank you again for the award. I very much appreciate it.